Yes, thanks, Liz. So Mississippi is seeing a rapid increase in the number of cases and also a significant rise in the number of hospitalizations due to COVID-19. Uh, for the previous week, leading up to December 25th, 59.6% of all identified cases were due to the Omicron variant, and the remainder primarily due to Delta variant. But as of 12/20 and forward of the specimens we've now analyzed, 67% are due to Omicron. Now, Omicron is significantly more contagious than Delta, but fortunately, it does appear to cause less severe illness. But regardless, we will continue to see additional hospitalizations and deaths, and many of which could be avoided. Important to reiterate that vaccination is still an important measure for COVID, especially for Omicron. Boosters are critically important. We know to get full protection against Omicron, folks need to have a booster. And if you've had a recent booster, the protective effect from clinical illness can be as high as 70% or more. So please get your booster if you have not done so. But even so, folks who've been vaccinated are protected from the most severe outcomes of COVID as far as severe illness, hospitalization, and death for the most part. Vaccinated people and those with prior infection can still get COVID with the Omicron variant and spread it. So it's important for people to be safe. You know, we don't have a lot of the monoclonal treatments available right now. We're trying to deploy them as quickly as we can. Most of the monoclonal treatments that we have are not effective against the Omicron variant. So it's important to prevent getting COVID right now while we're waiting. Additional doses of the oral antivirals, which we'll discuss a little bit later on, and then the single form of monoclonal antibodies that is useful against Omicron called sotrovimab. So for the next couple of weeks, please be especially careful especially going into the New Year's holidays. We know how to prevent transmission of COVID. We've seen a lot of transmission in congregate settings. We've seen, almost a fourfold increase in the number of outbreaks in long-term care settings. We've seen a lot of outbreaks in social events and in other gatherings. So please be very careful as we go into the next couple of weeks. And I'll kick it over to Dr. Byers.
Hey, thanks, Dr. Dobbs. And, just to reiterate what Dr. Dobbs was talking about, we are seeing some pretty rapid growth in our case numbers. And, I know that many of y'all are experiencing this. You probably know people who are infected and how easily it's being transmitted right now. We're seeing rapid growth in nursing home outbreaks. We're reporting out over 140 long-term care outbreaks today. Of those, 100 are nursing homes. When we look at that compared to just about a week ago, I think we had a little bit over 60 overall long-term care outbreaks, and of those 40 were in nursing homes. So we're seeing rapid growth in nursing home outbreaks, but we're also getting reports of increased outbreaks that are occurring in social gatherings, really wherever people are gathering, especially indoors. We're reporting out over 3,500 additional cases today, just in that one-day report. Of those, we have 19 additional deaths. When you look at this last 7-day period, just going back 7 days, we've had over 10,000 cases that have occurred. And when you compare that to the previous 7-day period, we're really at twice as many cases just in a 7-day period, and that's how fast we're seeing things grow. In addition to the outbreaks, we're seeing increased demand for testing. We did over 80,000 additional tests last week in the state. Our percent positivity is raising to about 11% now. And so, with the outbreaks, with the increased cases that we're seeing, with the increased demand on testing, with the percent positivity going up, when you look at overall in Mississippi, we're at high to substantial levels of community transmission, really in all parts of the state. We really are in the fifth wave now of COVID for Mississippi. And, our hospitalizations are increasing rapidly as well. And I know Mr. Craig is going to talk a bit more about hospitalizations, but we've seen a rapid increase in the number of new admissions for folks going into the hospital. We've seen some kids in the pediatric ICU for COVID. And so it's all going pretty rapidly right now. We don't have a lot of impact on the schools, right now, but they're out. I anticipate that by the time we get the schools back, that we will see some impact in those settings. The schools have historically been a reflection of what's going on in the community, and we're seeing a lot of community transmission right now. So I anticipate when the schools get back that we will see a substantial number of cases that are affecting those school-age kids. When we look at where most of the cases right now, it's in the younger folks. That's kind of been where the rapid growth typically happens when we have a new variant that jumps in. And so those folks 25 to 39, that's where we're seeing most of our cases now. That's the rapid growth. We're also seeing some increases in kids between the ages of 18 and 24. And so, these are the people that are usually out and about more, and we have a potential for increased spread with those individuals. When we look at the deaths, however, the majority of deaths are still occurring in people 65 and older, and in people 50 to 64. These are the most vulnerable people. This is where the real impact is, and we need to make sure that we keep those folks protected. When we look at our strategies for treatment, Dr. Dobbs had mentioned that our overall supply of monoclonal antibodies, which have been an enormous benefit for us for treating COVID early in the course of illness, are in short supply. The Regeneron product that we've used quite a bit throughout the pandemic, the bamlanivimab and etesevimab product are in short supply, and they're really not effective against Omicron. But it's important to understand that we are still seeing some Delta in the state. It's rapidly declining as we see Omicron increase, but we are still seeing some Delta that's occurring. We are distributing these limited supplies out that we have to the hospital centers of excellence. We also have a very small supply of sotrovimab. This is a monoclonal antibody that has retained activity for treating and is still effective at treating the Omicron variant. And so we are distributing that out to some hospital centers of excellence as well. We're working hard to get additional monoclonals to the state. We're working with providers throughout the state that still have a surplus of some of the monoclonals to pull that back in and redistribute it as needed to those places that are seeing the highest activity. And we hope to obtain additional monoclonal antibody treatments next week and in January as well. And so we're working hard to get more, but people need to understand that these are in very short supply right now. And we are distributing out to those centers of excellence that we can to get those treatments in folks. We do have oral antivirals coming on the horizon as well, molnupiravir and Paxlovid. Both of these are used in outpatient settings and can be used to treat in the very early part of the illness. But overall, we have less than 3,000 doses of those that have been allocated to the state. Now, we are going to be distributing out some of these that will be available to select centers of excellence, hospitals, and FQHCs later this week and really early in next week, as quickly as we can. And we're hoping to get more of those antivirals available and in the state by the first couple of weeks of January. But again, these are in short supply as well. So what do we need to be doing right now? Make sure that you're vaccinated if you haven't been. We know that our vaccination rates are still relatively low in the state. Only 48% of our total population has been fully vaccinated so far. And of those, only about 29% have received the booster. We know that with full vaccination, and especially with receiving the booster dose, that you can blunt the impact of the infection from Omicron. You can reduce the severe illness, reduce hospitalizations, and reduce deaths. That's one of the keys. But also, Wear a mask when you're in indoor public settings. Think about those public settings that you're going to and try to limit those interactions outside of your immediate family. Wear a mask when you're at work. Wear a mask when you go out in public. Masks do work at preventing transmission, and that's very important. These are the keys to moving forward. Our vaccination, thinking about where we're going and what we're doing, wearing a mask when we can. CDC, and this is the last thing I'm going to say, because I feel like I've been talking for 20 minutes. CDC has modified and shortened the isolation and quarantine periods for individuals who are either infected or have been exposed. And so if you've been infected, instead of a full 10-day isolation period, CDC now says 5 days of isolation. That means at home, away from everybody else so that you don't transmit it to anybody. And then you can come out of that isolation and continue to do activities outside of your home as long as you're wearing a mask at all times. And that's going to be the key. If people adhere to that and that simple piece, then we can help reduce some of the transmission. We know that most of the transmission that occurs when a person is infected is early in the course of illness or in a couple of days prior to illness. So, make sure that if you do come out of that isolation after 5 days, if you're going out and about, wear a mask. If you have been exposed to COVID and you've either gotten a booster dose or you've been fully vaccinated within the last 6 months with an mRNA vaccine or fully vaccinated with Johnson & Johnson in the last 2 months, then you don't have to quarantine. It's recommended that you wear a mask for 10 days to prevent you from transmitting it to other people if you do happen to have a breakthrough infection. But you don't have to quarantine at the house if you meet those criteria. If you haven't been fully vaccinated, if you haven't, or if you've been fully vaccinated, but it's been more than 6 months, or if you haven't gotten that booster, then if you're exposed, quarantine for 5 days at least. Sit at the house. If you come back out, you can come back out after 5 days, but you got to wear a mask. And so please adhere to those. I'm not going to try to interpret all of the nuances of that CDC guidance, but it's out there. And we're recommending that people adhere to that guidance. So Dr. Dobbs and Liz, I'm going to turn it back to y'all. That felt like that was a whole lot of information, but we can certainly answer questions.
Okay, thank you, Dr. Byers. So, Mr. Craig, let's talk about the good news first. Will you enlighten us about the expanded testing statewide?
Yeah, Liz, and thank y'all. We have, as Dr. Byers said, we've seen a lot of demand for testing in our state, especially this week. Remember that COVID testing is widely available through our partners, including physician offices, the federally qualified health centers, our participating centers of excellence providers. There are just a number of people providing testing in Mississippi. You might also recall that in counties where there was very little or no free or no cost testing, that MSDH has contracted with Maverick Health to provide some testing. Most of these locations are at our county health departments, but a few are at some of the larger venues so they can accommodate the increased volumes. So starting this week, we began expansion of COVID testing capacity around the state to try to meet the increased demand. I do have a couple of slides I'd like to share real quick just to go over some of that increase. You see the slides? So currently in our community testing plan, we have 41 sites in Mississippi that Maverick Health again is providing this testing around the state. If you look at some of the changes that we've made this week, we've increased the number of testing appointment slots at the Adams County Safe Room, Claiborne County Health Department, the Houma County Health Department, at our Hernando location in DeSoto County, in Hancock County, Harrison, in Jackson County, in Lafayette County at the Oxford Conference Center, in Leake County, Lincoln County, and Lowndes County. You'll notice that both in Lafayette and Lowndes County, we have doubled the number of slots that were available previously in those two counties. Also, if you look at Marion we increased from half to full days at the county health department there. Marshall County, Panola County, Pearl River County. In Scott County, we went from 3 half days to 4 full days, and increased the appointment slots there Tuesday through Friday. In Stone County, we've increased from half days to full days and increased appointment slots, and also in Tunica County. We look at Trustmark Park in Rankin, we doubled the number of appointment slots, and we will also be operating New Year's Day from 8 o'clock till noon at the Rankin County location at Trustmark Park. In Himes County, in our farmers market, we'll also be operating New Year's Day for their normal half-day schedule that they operate on Saturdays. In DeSoto County, today, working with DeSoto County local officials, they're providing the South Haven Community Safe Room as another location in DeSoto County. So we're operating in the health department in Hernando, and starting tomorrow at the corner of Highway 51 North in Dorchester, we'll have an additional location in DeSoto County at the South Haven Community Safe Room. So we appreciate the work of the DeSoto County officials in securing a spot for some additional testing in DeSoto County. So if we look total appointments statewide since Sunday night, our slots have increased from 15,000 to a little over 20,000 slots. And currently, right before we started this press conference, 13,220 slots are booked at this time for additional testing appointments. So still a lot of demand in Mississippi for testing. Well, also remember that you can sign up for appointments through the UMC scheduler at covidschedule.umc.edu. And we will be making some further updates to our appointment system as increased slots are made available later today and ongoing. We'll continue to watch where the appointments are being made, and where we're short of appointments, we'll continue to try to add resources and a different additional appointment slots in those areas. But also remember, we're not the only outlet for COVID testing. Again, you can check with physicians, our COVID qualified health centers in the state, and our participating centers of excellence for additional testing opportunities. We have noted the supply of testing may be limited in some parts of the state. We're working to continue to increase the availability of testing and testing supplies in our state. Also, remember, as Dr. Byers and Dr. Dobbs both said, that prevention is an important piece of this. Getting the vaccine, getting those booster doses are critically important right now. Remember that COVID vaccination and booster shots are widely available throughout the state, including our county health departments. If you need to schedule an appointment for either a COVID vaccine or a booster shot in the county health department, you can go to covidvaccine.umc.edu and make an appointment for one of those. Also, on the healthcare front, as you know, there is a national shortage of healthcare staff. And here in Mississippi, we're experiencing it just like the rest of the country. Our COVID-related emergency department visits during the first 3 days of the week were over 1,700 patients per day. We're also seeing a rapid increase in new COVID admissions, with 445 total COVID admissions in Mississippi hospitals as of yesterday. As Dr. Byers said, we're seeing high levels of community transmission in most of the state. You can always go to CDC COVID data tracker for more information on particular counties and what they're experiencing at this time. Also, as Dr. Byers and Dr. Dobbs explained, it's important to do everything possible to stay well and to lessen the burden on the Mississippi hospitals at this time. Current reports that we're getting from the healthcare system is that most Mississippi hospitals are still experiencing staffing shortages and have very limited bed capacities. We've also received reports that it's becoming increasingly difficult for some of our community hospitals to transfer patients to some of our larger facilities in the state, mainly due to the lack of staffing for those beds at those larger hospitals. Happy to report that our state stockpile of PPE is fully stocked and will continue to assist as needed. And while there have been reports of national shortages in some of the testing supplies, currently we're continuing to fill orders for testing supplies as requested, and as well as securing additional product from some of our testing vendors. So again, we're doing everything we can to work with our state and federal resources to obtain more testing material for COVID, monoclonal antibodies, and oral antivirals. With that, Liz, I'll turn it back over to you.